Hello, everyone. This is Maria Fakis. I'm Executive Director of ADONIS Fertility International. We're located here in the United States. And with me today on our Hot Seat Wednesday, on our bi-weekly webinars, I have a phenomenal professional, an expert, Luiza Kuryliuk. Hello, Luiza.
Hello. Nice to hear.
Yes, thank you. Thank you so much. Luiza, I'll let her introduce herself and, share a little bit more about her background, but I'm just also excited, about a couple moments about this speaker because she is actually coming from our kind of, mother company, I would say, medical group, ADONIS Medical Group, that is located in Ukraine. So Luiza is right now, she's, joining us from Ukraine. And so you guys could understand that ADONIS Medical Group is one of the largest privately owned medical operations for the whole country, okay? So we specifically wanted to bring an angle for you today when we're talking about donor eligibility, donor process, because in many cases, families coming to us or they might be searching other options where they're saying, guys, cost is a big consideration for us. When you're coming to the question of donor, in many cases, it might be not your first journey, right? Or, there are different, situations and different constraints on the budget. And so, it's really heartbreaking to see where some of you might need to make a decision not to go through your journey and stop your dream of a baby, okay? Because there is this obstacle. Another consideration, and also why families are looking for the donors, not only in the United States, but outside of the United States, is definitely a particular phenotype, a particular characteristics that they are looking for, okay? So we get those questions. What does donor eligibility means? Is donor eligibility specifically in the United States? And guys, today we're going to be talking specifically for United States, but some things will apply to other countries as well. So there are requirements for the donor in the particular country. There are requirements where the donors are coming from. So we're noticing there are some misconceptions. We're also noticing there are some questions that families might be asking or not asking when they're coming to their fertility clinic. So we really want to equip you with tools. Whatever path you choose, that's completely up to you. We respect your decisions. We are so happy to support you in any capacity, but today we're coming as a thinking partner, and we just want to expand your understanding of this very important topic of donor eligibility, so you really know what is happening and what you could ask and what and what options you might have. Yes. So sorry for this long introduction, but let's jump in. So Luiza, tell us a little bit about your role at ADONIS Medical Group in Ukraine, and then just a little bit about your background as well.
Okay. For the past 7 years, I have been working in the medical field. It all began with my role as a partnership manager at Bukimed, #1 international medical tourism platform. And since 2020, I have been privileged to continue this journey at ADONIS, where I'm actively engaged in various international projects involving carefully screening donors like egg donors, stem cell donors, sperm donors. And my main project is the ADONIS Frozen Donor Egg Bank, where our mission is to provide unwavering support to patients on their plan to parenthood through collaboration with leading clinics across the United States. And my personal goal is to ensure compliance with the rigorous FDA, American Society for Reproductive Medicine requirements and criteria for egg donors at all US states, and meet the internal criteria for frozen donor eggs at every clinic in the United States, tailoring our offerings to their specific needs when necessary.
Okay. Well, thank you so much. I know you look very young, and sometimes, people, it could be misleading, but guys, I cannot tell you enough how much, what a vast knowledge and expertise Luiza brings. So don't get fooled by, her young appearance. This lady, the way she researches things and the way she gets answers is, superb. Okay. So I really hope that, through the rest of the, questions that I have planned for her, you could really gain, some extra insight into that big question of the donors. To also narrow our topics, because Luiza said that, she comes, from the background working, and the projects involve donor of oocytes, donor sperms, stem cell donors. Today, we're specifically only focusing on donor oocytes, which also means donor eggs. Sometimes families are asking, what does the word oocyte means? Yes, so this is kind of, I guess, the industry word, or, more professional word for the eggs. Yes, so donor eggs, donor oocytes, interchangeable words. Okay, so Luiza, so yeah, give us kind of like a big picture of donor eligibility. And of course, we are talking from the perspective of intended parents. Guys, we're not talking, this meeting is not intended for like third-party coordinators or, the doctors or anyone who is working on, just like Luiza and her team physically approving, and checking eligibility of the donor. This is more like for us common people. So if you're a parent, okay, or maybe even a donor, okay, and you're trying to understand like which donor can I select and what could be the reasons that the donor might not work for me, okay, that's what we're talking. So in simple terms, donor eligibility.
Okay, egg donor eligibility is the criteria that a woman must meet in order to donate eggs for assisted reproductive purposes. These criteria typically include age, overall health, reproductive health, medical history, genetic background, psychological evaluation, and meeting these eligibility requirements ensures the safety and well-being of both the donor and the intended parent. Additionally, eligibility criteria will vary between different countries, fertility clinics, egg donor agencies. When we are talking about FDA egg donor eligibility,
And I'm so sorry, just let me just pause you for a second because you're going into some very important things. So when you talk about FDA, pause for just one moment. So what does FDA eligibility means for United States? So first, I'm sure everyone knows, but just in case, what's the FDA stands for?
In the US, it refers to specific criteria outlined by the Food and Drug Administration, FDA, that egg donors must meet. All clinics, egg banks, egg donor agencies must use FDA guidance for industry for eligibility determination for donors of human cells, tissues, cellular and tissue-based products. In accordance with the FDA, egg donor eligibility determination is a conclusion that a donor is either eligible or ineligible to donate eggs based on the results of donor screening and testing. The donor is eligible only if screening shows that the donor is free from risk factors for and clinical evidence of infection due to the relevant communicable disease agents and diseases, and test results for relevant communicable diseases agent are negative or non-reactive. So when we say that the donor is free from risk factors, that means the donor has completed a detailed risk factor questionnaire, which includes questions about social behavior, sexual relationships, medical history, a history of visits and residence in other countries, and more. All these questions are clearly outlined in FDA guidance. This questionnaire should be reviewed and discussed with the doctor, and we should determine any potential donor who exhibits one or more of the risky conditions or behaviors as ineligible to donate. A copy of this completed risk factors questionnaire is always available for the clinic accepting all sites to review. For egg donor testing, all clinics should use a specific list of tests named FDA female egg donor screening.
Mhm.
This list includes chlamydia, gonorrhea, hepatitis, syphilis, West Nile virus, human immunodeficiency virus, and others.
Mhm.
And the clinic should use appropriate FDA license and approved donor screening tests like kits,
Mhm.
vials,
Mhm.
FDA approved. Tests should be performed by FDA registered labs and labs certified for such testing on human specimens under the Clinical Laboratory Improvement Amendments like CLIA. So,
Mhm.
who makes the donor eligibility determination? In
Mhm.
accordance with FDA, a responsible person must determine and document the eligibility of the donor, of egg donor. A
Okay.
responsible person is one who is authorized to perform designated functions for which he or she is trained and qualified. A responsible person should have an appropriate medical training and adequate knowledge of relevant federal regulations and guidelines.
Mhm.
Uh,
Mhm.
at ADONIS, a egg bank, the donor will not be determined as an eligible donor if donor is less than 21 or over 30 years old.
Okay.
If donor has no children,
Okay.
uh, donor was rejected for medical reasons, including the presence of infectious, viral, chronic diseases, serious genetic diseases,
Mhm.
hormonal imbalance, low ovarian reserve, etc.
Mhm.
If if donor leads an unhealthy lifestyle, smokes, takes alcohol or drugs, if
Mhm.
donor failed the risk factor questionnaire we
Mhm.
discussed
Mhm.
earlier,
Mhm.
if donor failed psychological evaluation, if donor has completed more than 6 egg donation cycles,
Mhm.
donor has gotten a tattoo or piercing in the last 12 months.
Mhm. Mhm.
So these are the main reasons um, not to determine the donor as eligible to donate.
Okay. So what I'm trying to, so from what I'm hearing then, just because donor is in America or outside of America does not necessarily mean that this donor will be approved or will not be approved. If the donor is coming, and actually there is even more scrutiny, I would say, if the donor is coming internationally, right? If the oocytes are coming, eggs are coming from another country. For example, in our case, from our facilities in Ukraine, because it really needs to make sure, all entities, checking that every single item on this list, on the eligibility list, has been done to the highest criteria. So you mentioned something, and I have a next question about what are some of the mistakes or misconceptions, but you mentioned something important where you said, like this infectious disease testing needs to be an FDA certified approved lab. Like, what does it mean in simple terms? Is it the lab that is ADONIS has this license, like in our example, or is it the lab in the United States? How does it work?
So, for example, this is one of the misconceptions when the clinic may say that no donors outside of the US can be used because they are not FDA eligible.
Mhm.
Because the clinic may think so, as they do not understand how clinics outside the US have established the donor screening process in accordance with these FDA requirements. For example, clinic can say there are no FDA labs in Ukraine, which
Yeah.
means this egg bank doesn't test donors appropriately, so donors are not FDA eligible.
Mhm.
But we do not need an FDA registered lab in Ukraine, as we can send samples to the United States to FDA and CLIA certified lab.
Mm,
We are sure that this testing performed in the US only increases the confidence in the results of this testing.
mhm,
And these FDA-approved kits is provided to us by the laboratories from the United States. So we use their FDA-registered kits, and we are sending all samples for testing to the US. Then we get a result, and then we use the result for the determination of donor eligibility.
And it's still done everything within the time frame outlined, by the guidelines of FDA, meaning, you drawing the test. It doesn't matter, that it's traveling, the specimen, but the test is drawn exactly when it needs to be drawn, like if the donor would have been, in United States. Is this correct? Do I understand it correctly?
Yes.
Okay, all right. Yeah, so this is really, I'm so glad that you're highlighting this misconception, because I think without understanding that, it's very easy to just say, oh, just because someone is outside, that's it, there is no labs, but you just answered the question. What are some of the big misconceptions you're noticing, when people are considering their options?
Also, clinic may say that donors from Ukraine are not FDA eligible as they are from Europe. In accordance with FDA regulations, individuals who spend time, lived, or traveled for greater than 3 months during the FDA designated mad cow risk in certain European countries are considered to have been exposed to a potential risk of transmission of mad cow disease. So they would not be FDA eligible, but US clinics miss the fact that Ukraine is not part of this list of mad cow risk countries. So as this disease did not affect Ukraine. So our donors are eligible, and we have the risk factor questionnaire in place. So, and we can see among the list of the specific list of specific countries, and if we look on it and check it, we can ensure that Ukraine is not mentioned here.
And also, but then someone could argue and say, well, yes, she lives in Ukraine, but what if she has traveled, to those countries? I know that you work, which could be an argument, but, I know that we're also checking, the travel, because there are stamps in the passport. So we're checking that. And would you also say, like, typically the ladies that we're working with, right? Like, not every lady would go and become a donor, right? So it takes a particular person, with a big heart to help other people to start their family, but also there are ladies, that perhaps have a certain social economic status as well, right? So this is not someone that just travels rigorously outside of the country. Is that the case?
So we are asking this question, and if we will see, and the donor will give us a reply where we see that she has visited country and spent any country from this list and spent there more than 3 months, we will not accept her for the program.
Yes.
In any case, so no matter, we will not.
Right. Okay. Well, thank you for sharing with us, how, like, that it's being triple checked. What some other things that you're noticing?
One more thing is donors are treated poorly in Ukraine. There is a huge growing private healthcare sector in Ukraine, particularly in major cities, offering high-quality services and more advanced medical technologies. Ukraine has a well-educated, skilled healthcare workforce, including doctors, nurses, and specialists. Many Ukrainian doctors receive trainings in reputable medical universities abroad, and also Ukraine is popular destination for inbound medical tourism, including IVF. So, like in any country, including the United States, not all clinics are, of course, not all of them are equally good. In all countries, certain clinics and doctors might engage in unacceptable behavior. However, it would not be it would be unfair to judge the overall quality of medical services in the country based solely on these isolated incidents. So these isolated incidents are often exploited for negative publicity, and good clinics, really good clinics, unfairly lose patients. And in addition, potential patients seeking high quality service at a reasonable price will lose such an opportunity because of this anti-advertising, because they are afraid of it. They get this information, and it sometimes it looks like this low quality of medical services, such a quality of services are at all clinics across the country, but it's not so.
Yeah, okay. Well, I know that I've been, to ADONIS Medical Group in Ukraine several times. Yes, and so also have been many patients from United States and also some of the partner doctors from different countries. Guys, I cannot tell you enough, like what a phenomenal facilities, and just, high level of medical care and attention to the medical integrity it is, right? And I'm not saying it just because I'm excited about ADONIS. It's really phenomenal. We have some patients that are coming, like you mentioned, medical tourism, because, sometimes, yes, people are looking, for the better cost offerings, not just in fertility, but in different things. Over and over, people say, gosh, like, I wish I could get the healthcare that is in Ukraine. So yeah, so when we're talking about good treatment of donors from the medical perspective, definitely ADONIS is probably, one of the best in the country, but also absolutely the same high level as you would meet in some top clinics in America. So this is hands down. So you still mentioned something, well, when we're talking about, treated poorly, right? So can we talk about, what are some of some of the pitfalls that patients must be aware of? What are some things that, like, I think, the question goes beyond just how medically they're being treated, but what about just ethical, side of the egg donation and some other parts that goes to that? Like, how would you, I know that we do get questions about that as well.
I think that okay, talking about poorly treated, I think this we can associate it more with egg donor screening process. Yes, so maybe clinics or patients are afraid of the quality of our donor screening methods and limited information we receive as a result of this process. But I can tell you a little bit more about, for example, what important details we should look on when we are talking about, and then of course about the ethical side.
Yes, please share.
Yes, for example. Egg banks, of course, may provide limited information about egg donors, including their medical history, personal characteristics, and this lack of transparency can make it challenging for intended parents to fully assess the suitability of the donor, but our screening process is very detailed. Clinics have frequently commented on our comprehensive array of examinations and tests, expressing surprise at the extent of our screening. Our online profiles on our website show only a small part of the information we get from donors. We are always happy to share more details with the patients and clinics. So our hormonal panel, instrumental diagnostics is more extent wider than is even required in the United States. If you I don't know if you remember that one of the clinics asked, why have you done this specific diagnostic testing? Was there any issue with the donor? So you decided to make additional tests or to involve another doctor to check this donor more carefully? And we said, no, this is our standard procedure for all donors.
Wow. So you're saying that the requirement of the testing that we have internally, they actually surpass the requirements of testing that exist in United States. Is that what you're saying?
Yes. And
Wow.
one more thing is our requirement on the legislative level when the egg donor should already have at least one healthy child.
I think that's very important one. So guys, imagine, so that, so we're kind of getting again to like some of the ethical questions. So in United States, donor is not required to have a child, right? So it could be, as long as the donor is healthy and meets age requirement, that is a possibility. So if we're talking about younger ladies, okay, who have not been mother yet, they do not understand the impact of their decision. How can they make this decision? So for us, actually, like, I'm very proud that we have this question in place, and that we only accept donors who already are mothers, right? Because the question goes beyond just, what is happening to me physiologically, right? How many oocytes will I have left, for myself and so forth. But also, what does it mean, that there will be genetically connected, kids, to my own children and so forth. So we know that the ladies who have been mothers, they take this decision very seriously, right? So thank you for bringing it up.
And also this fact that all our donors already have at least one healthy child. We do not accept donors without children, as we have mentioned before. Our patients will always have access to the photos of their donor child. And we think it's a wonderful chance to see not only the photo of the donor, but also how much do their children resemble the donor. I think it's a really great possibility. Of course, we also show the photo of the donor in childhood, and this is so. Let me give a small comment on the photos as well. When we are talking about choosing a donor based on a photo provided by Egg Bank, we have seen hundreds of profiles of egg donors from different egg banks, and in 90% of profiles, we can see donor selfies with the filters used with Photoshop, or photos from professional photo shoots where light correction, retouching were used. And of course, we
A lot
understand
of
that
makeup
this
too.
we are a lot of makeup. We understand that these photos are far from reality, and the donor does not look like this in real life. At Adonis Egg Bank, we show only photos that were taken at our clinic with no Photoshop or filters. All donors are dressed in a similar way. They're in jeans, white or black t-shirts and sneakers, so you can make a fair choice.
So you
Some
really
of
see
our
the shape of their body and their current condition,
yes,
but also not a photo that maybe have been from 10 years ago, you know, and suddenly and now donor is looking differently. So I really like that honesty and transparency, which is huge.
yes, this is the real photo taken on the start of the donation program. So this is the latest photo, and some of our donors are coming with their children. We also show these photos. Of course, in rare cases, our patients are asking for more photos, and we, of course, can ask the donor to provide more personal photos, and we can show them to our parents, but as I have mentioned before, we think that the fair choice should be based on the real latest photos, and all donors are photos are taken in the similar position, so we can see and compare them, and it's really perfect possibility to make a fair decision.
Right, based on the real information. Okay.
Yes.
I also noticed that, you know, we started including, well, you know, all of our profiles also, well, at least for United States, I should say, you know, because we have that special process, you know, for the, based on the FDA regulations, is, you know, where you also get like access to the handwriting of a donor. In some cases, we also have voice recording, right? Or like, would you talk more about that?
Of course, we provide so they pro all our donors are filling the detailed questionnaire. As I've mentioned, we show only a part of this information in the profile available on the website, and we are able to provide more information about like medical history interview, family tree. Each of our donors is completing emotional intelligence test, and we are showing the results of this test as well. We have also the information, of course, photos of the donors, the latest photos, photos from their childhood, photo of their child, voice record, handwriting. For all donors, we are providing voice records and handwriting. And for most of our donors, we also have like short videos, like reels, which were taken during the photo shoot. Here at our clinic as well.
Oh, wow. Okay. All right. So parents could have access to it upon request. This is phenomenal. Could we also, you know, just before the meeting, you know, we were discussing one of the case with you of a parent, guys. So it's less about eligibility, but this is something that is very important for you to think about when you start the process. And sometimes, you know, you come into the process and just saying, I just need a donor, right? So we, of course, you know, the donor is being tested and everything, but you also need to understand there are two sides of the process. So one of the areas that you really also need to be looking into, have you done any diagnostics and testing yourself, right? You know, like, would you kind of share some of the best practices for the parents as well, including, you know, testing, you know, for the semen analysis, right? Testing for the genetic screening, right? Because this is something that goes, you know, because all of our donors also are genetically screened for very large panel. So talk us through that as well. Just what are some things parents should be aware also from their side, and maybe what are some questions they should be asking of doctors when they're considering the next steps with the egg donation?
Okay. So, of course, semen analysis and genetic screening are the most important things to start with. The majority of our patients already have this information when they are coming to us, or at least they have semen analysis results, but they are still waiting for the genetic report. So we provide the results of the genetic test for 420 diseases. So all our donors are tested for 420 genes.
Mhm.
And this is one of the main questions parents should ask about potential donors when they are contacting the egg donor agency or egg bank. So can I see the genetic test results?
Mhm.
Also, the next question will be, do you provide a guarantee, and what are the requirements to have this guarantee in place?
Mhm.
And of course, the sperm quality plays a crucial role in success of an embryonic development. So absolutely all egg banks that provide embryo guarantee will require the minimal sperm quality parameters.
Mhm.
And if these parameters are low, the guarantee will not be met. We always share this requirement transparently. It's also settled in our agreement.
Mhm.
Um, this is the most important thing when you will be talking about the guarantee with your egg donor agency or egg bank, to look at these parameters for sperm source. The
Mhm.
next question will be, of course, what is your egg donor screening and eligibility determination process? We had discussed it before, so this should be one of the questions the parents should ask about. Also, the question to ask should be, could you please provide more real unprocessed photos of the donor?
Mhm.
And also ask if it is a proven donor or a first-time donor. And if it's
Mhm.
a proven donor, patient should ask to share her results in previous programs.
Mm-hmm. Mm-hmm. That's very important. You actually, okay, so, and I know we only have about 18 minutes left. Let me ask you two questions. One question I want to talk about integrity of the process, because we do get questions. They saying, okay, you're showing us the donor. How could I be sure that the eggs that I have purchased and you have delivered to my clinic are actually the eggs of that donor? Right? So talk us through the process where integrity of that process, especially in our clinic, it's so tight. We watch this, like all of the processes are set to, to ensure that it's like, from the moment, how the donor is being identified, the marked, how they're being checked, and coming with the coordinator, how each straw that contains oocytes marked with that unique code, and it comes all the way, through the process and then on a transportation as well. So talk us through that. And the last question after that, I want to talk a little bit more about that we keep coming back to the ethical side of the donor, but I think you start talking about it and I interrupted you, but talking about the uh, and maybe it's also good, like not just for intended parents to understand, but also for the donors, if the donors are listening to that, just really fully understanding the whole medical procedures, the impact that will be on them and on their body, what to expect, and then also financial side. So let's start with maybe integrity process and then finish with that ethical sides of the donor it's really becoming a big question, I think, for the industry.
Okay, when we are starting operating in the United States, we have to be FDA registered. So FDA registration means we are providing to FDA all our paperwork regarding standard operating procedures in laboratory, all clinicians are how all clinicians are working on the whole process, starting from the first visit of the donor till the moment of the egg retrieval, and then freezing oocytes, storage, and logistics to another clinic. All donors get their unique code with like it's a number. Of course, all donors are anonymous. We do not use names. Each document is marked with this personal code, with this number of the donor. Each sample, blood sample, urine sample for testing is also marked with this code. When we are sending the test to genetic laboratory, to FDA laboratory, we always enter this code, and we always have at least two persons to double check the information entered on the vial or into the document which we are sending together with the sample. For example, we have a coordinator who is double checking everything and helps with the logistics, and we have a nurse who is like filling out the vials with the urine or blood, and enters the labeling, and then another nurse is checking this information, and then this is shown to the coordinator. Coordinator is checking all these samples and completes the paperwork for the lab. And of course, in each of these steps, we are adding the personal code of the donor. All records we have in place are like in hard copies and also electronic copies in our CRM system. Also, of course, each straw is labeled and marked, and we have special SOPs for marking labels for each step of logistics of moving samples across the labs, of moving frozen oocytes to our storage facility, then moving them to the clinic. We are completing special specific documents like requests for transportation, where all the details of egg retrieval, of a quantity of straws, of labeling of each straw, the color of each straw are mentioned, and this information can be checked on each step. For example, the laboratory is freezing oocytes at the date of egg retrieval and is providing digital information about the number of straws, their colors, their codes. Then this information is sent to the storage facility, where the storage facility is checking everything and all paperwork provided as well. When we are moving the oocytes from the storage facility in the US to any clinic, this storage facility takes out these straws and again they are checking these codes, all the hard copies, because we always provide hard copies of each accompanying documentation together with the oocytes. So we at ADONIS Bank have been FDA registered and having California tissue bank license, New York's tissue bank license, are meeting the requirements and have our standard operation procedures here in place to ensure the safety of all processes, double checking, triple checking each step. It's not, in fact, it's not like something complicated, because it's a routine, normal practices for any reputable IVF clinic or embryo lab to work in this way. So in fact, it's not something extra, it's like a basic things we should
any clinic should do.
Yes.
Yeah, absolutely. Well, I think it's very important, just because, again, sometimes people think oh my God, like, you know, everything outside of United States is scary and it's different and it's, you know, everyone lies and, you know, everything is done under the table, you know, it's crazy. It's really not. So
And the
it's,
clinics even ask if the labeling is done in English. Of course, we do this labeling in English because we are working not only with the United States. ADONIS also operates in Europe, in Israel, and we are able to ship to any country. So we are doing all our paperwork procedures like not only in accordance with the requirements of our government, but also meeting the requirements of other countries.
yeah, yeah. Well, thank you so much. Well, on top of that, you know, of course, there are also internal audits, you know, as a medical institution in Ukraine, you know, all of our clinics, they have to go in, including fertility clinic, our cryobank, our embryology department, our fertility, you know, clinic, everything has to go through yearly audit. And that audit, guys, is very serious. You know, it's very intense and it's very detailed, where every paperwork for every donor, and then, you know, is being checked and it has to match with the quantities left at the cryobank and so forth. So like, anyway, so I really want you to understand that there is absolutely no possibility for any errors on the medical integrity side. And we're so proud of the process. Well, yeah, so, and yeah, let's end maybe with this, you know, just on the donor ethical side, understanding the medical procedures, you know, gosh, the question we get, yeah, you know, are they being fairly paid? And I know you have a very good answer for that one as well, which I think it speaks volume to just how much we value every stakeholder of the process, including donors. You know, yeah. So talk us through that.
The ethical side of egg donation process is a huge topic, really, for a separate webinar. But what should we know? The donors must fully understand the medical procedures, potential risk, and of egg donation before giving their consent. It's crucial that they make informed decision without pressure and have the opportunity to ask questions, make informed decisions without feeling pressured. All our clinicians are educated about the ethical consideration. There is also a concern that financial incentives or like societal pressure could lead individuals to donate eggs against their better judgment. But we take a lot of steps to ensure that the donor's decision to donate is altruistic. One of the most important steps is the psychological evaluation and understanding the donor's motivation, family and financial situation, and mental health. There is a debate over the like around the fair compensation and whether paying donors could exploit vulnerable individuals. However, we have set a fair compensation rates for donors that reflect the time, effort, and potential risks involved in the donation process. We avoid offering excessive financial incentives that could unduly influence individuals to donate against their better judgment and limit the number of donations to 6 times. We have a donor safety policy and a code of ethics in place, but this is a really huge, wide, separate topic to be discussed on another webinar, I think.
So let's come back to that as well. Yes, because well, it's not just, you know, what it means, you know, from the health of the donor. And I'm so glad to hear that, you know, we do have this very strong limit. I know, you know, some clinics do not, and the donor will, you know, continue donating for as long as possible. But it also goes back, guys, you know, to all of those genetic connections for your kids and so forth. So thank you for bringing it up. Definitely, let's plan for another topic. Okay, well, so I kind of ran through all of my questions and also some of the questions that families have sent ahead of time. Guys, for any one of you who is now listening live, you know, we have about 6 minutes. If you want to ask anything in addition, absolutely, we're here to support you. But otherwise, you know, the session is being archived. We're definitely going to post it on YouTube. You know, you could subscribe to our channel so you could get notifications, you know, when we have some updates. Yeah, and we'll also send emails. All right. Okay. Well, I don't see any additional questions. So thank you so much. Thank you, Luiza, for joining. It's quite late for you. Yes, thank you for taking part of your evening and being with us. Yes, thank you for everyone who joined us live. And yeah, guys, we're just so excited to support you. Again, we're not insisting on any particular path, but we are always looking for more options for our families. So it definitely breaks our hearts when sometimes we're seeing that some options are not being considered because there are big misconceptions. So I really hope that we were able to a little bit uncover those things for you. If you have any questions, okay, if you are thinking about the donor, if you're trying to understand what is the process, if you need to have access to our donor database, well, that's specifically for United States, right? Like for eggs available in United States, because we have other programs as well. You know, if you need to talk about, you know, any of the screenings, yeah, so come to us. You know, we have a whole team to support you, so please do not hesitate. Maybe I should ask, well, if anyone is interested, so maybe we're gonna put email for your team. Yes, Luiza, you know, how people could ask. Maybe we're gonna put it under archive, right? If anyone has questions, would that be okay?
Yes.
Yes. All right. Okay. Well, wonderful. Thank you, everyone. Please stay safe and healthy.
Thank you.
Yeah, we cannot wait to continue supporting you. Thank you. Thank you so much.
Thank you.
Bye-bye.
Bye.